All right, welcome back to the show, everybody. On today's show, we have a very special guest, Andrada Mihaela. Andrada, how you doing?
I'm doing great. How are you?
I'm doing awesome. Just had great lunch, a late lunch, and I'm feeling good and really excited to learn more about you and what you do. So with that
Wonderful.
being said, can you tell us a little bit about yourself and who you help?
First of all, I'm excited to be here. I think this is such a beautiful opportunity, and it's wonderful that you do this. I am. I would say that I'm an outlier because I'm not a big podcaster. I very rarely watch an entire podcast unless it has something to do with school. I teach college, but I've been watching your series, and I want to say that you've gathered a pretty nice cohort of extremely well prepared therapists. So that was a nice incentive for me because it made me feel comfortable enough to come here and talk about myself and share a bit of my wisdom, quote unquote, right?
Yeah.
um,
Well, thank you for your kind words. That means
right,
a
of
lot.
course. It's beautiful that you do this. Like I said, there are not too many um, people in the industry that make themselves available to the world pro bono per se, right? So I always look for the ray of hope in the darkness, right?
Mm,
And not to sound facetious, I feel that as clinicians we are grossly underpaid and overworked. So most people end up having to streamline form different forms of income. So it makes sense that um yeah, everything is a very paid type of exchange, but not to derail, because I can do that very easily. So I'm going to start with a bit of self-disclosure. I am a neurodivergent therapist. I was diagnosed ADHD as a young child in Romania, and it was such an unheard of type of diagnosis that my mom said I didn't have it, so I didn't. And it took me years to finally come to terms with myself and to get the help that I needed, and to um, allow it to work for me and not against me. So, on that note, I'm a licensed mental health counselor in Massachusetts. I'm also licensed in Connecticut. I hold a doctoral degree in counseling supervision from Springfield, locally Springfield, Massachusetts College. The name of my college is American International College. I like the name I like the fact that it had the name international in it, because as a Romanian immigrant, that felt right to me. um, and it was at that time the only program that offered enough flexibility for me to work full time while going to school full time. Um, I work. I'm also Gottman trained, so I do some couples counseling, but I mostly work with individuals facing um, life transitions, uh, those kind of challenges. Um, I would like to say that I have a specific specialty. I ended up being a grief counselor by um, accident, if that's ever happening. I've always been passionate about grief, so grief became a big topic for me when I started working with individuals with severe medical trauma, or people who were hospice patients, or um, palliative care patients, right? People who were now in the position to contemplating their own death while still being alive. So heavy load, heavy topics, um, which makes it difficult at times to for me to hold. So, but yeah, here I am. And like I said, I do not like being viewed as the expert in the room. I am just a fellow traveler. We're going down this path of life together, right? And we grow together.
yeah, yeah, I really appreciate that, and and I appreciate the humility too, because I think that's a testament to the quality of work that you do. And especially with clients when they show up and they're already kind of intimidated by the therapist if they haven't maybe done therapy before. So the fact that you can kind of just put that behind you, even though you are highly trained, very trained, lots of schooling. It's really great to know that you can put that to the side for a second, just be a human and just be present with somebody and be a fellow traveler. That's really cool. Adrada, I like to ask, how do you make sure that you are a good fit for your client and that your client is a good fit for you?
Um, this is an interesting topic, and I'm so glad you asked this. A lot of people will come to me and say, I was in therapy for a number of months or years with this person, and we never went anywhere. And I just kept going and hoping it got better. And I don't understand why we're so hesitant to changing therapists or changing directions. Um, if somebody's not the right fit, like if somebody gives you a bad haircut, you don't go back there, right? We're so resistant to changing therapists. Um, in my opinion, that has been my experience anyway. Yet we would never go back to somebody who didn't do a good job on our hairstyle, right? And so the therapist should be this place where the therapy office should be this place where you get to be 100% entirely yourself. And I mean that wholeheartedly. Um, and I will never take offense to a person telling me I don't think we're a good match. Um, it has happened in my career where I personally felt that I was not a good fit for a person, or I didn't have the expertise, or they needed to be met in a different way that I could meet them, and I had no problem expressing that and referring them out. Um, and that's I said, I would say that you should make the environment so comfortable that the person sitting in front of you has doesn't have a difficult time expressing that maybe this is not going to work out. So I don't know how I don't make an assumption about people. I have no I'm very Rogerian in my approach, in the sense that I bring the unconditional positive regard to my sessions. I am willing to work with anyone and everyone, regarding of background, the creed, a religious association, or whatever, as long as they're willing to work with me, and I see that, um, you know, after a few sessions, that there's progress being made, right?
Yeah. Yeah, that's awesome. So do you offer maybe a consultation call, or how do you kind of make sure that people will be a good fit from the beginning, from right before they're reaching out?
I have started with 15-minute calls, and
Okay.
if we concluded that we were not going to be a good fit, I have offered to refer elsewhere, or
Got it.
ask people to move on to the
Okay.
next therapist. That's okay. Like I said, a consultation is a good start.
Yeah, yeah. Yeah, for sure. And I think consultations are really, I encourage everybody who's listening, who's maybe thinking about the consultations, like they're free, right? Like you don't really lose anything, and maybe just a little bit of your time, but it's a great way to really feel out your therapist, and just to see if it's a good vibe, so that you could go to the first session. Speaking of the first session, Andrada, what does the first session look like with you?
It's the typical, what brings you here today, right? We don't, not all of us have this great privilege of coming to therapy on our own accord. Sometimes I've worked in community mental health with people who are court mandated. I've worked with clients who were going through separation, and the attorney thought it would be a good idea for them to be in therapy because it looked good on paper or whatever. We all want to work with that person who's ready to, take on, the accountability, and they want to be in therapy because they want to be there. In reality, that is, I don't want to throw a number out there, but I think it's a small percentage. Most times people come to therapy because their spouse wants them to, or they're having issues at work, or now it's become an issue and they have to go to therapy. I would like to see more of those people who come to therapy because they want to be there. And yeah, we start with what brings you here today, right?
Yeah, yeah, that's awesome. Yeah, for sure. And I do appreciate what you're saying about maybe not waiting until there's a problem. There's something to be said about being a little proactive, and maybe the landscape of therapy will change in time, where people will be more willing to have this be a
Yes.
regular part of their maintenance. And just overall general well-being. So yeah, I appreciate that, and maybe that's a whole conversation for another day. um,
For
an-
sure, yeah.
yeah, Andrada, I'd like to ask about your specialty. I think you mentioned being Gottman trained. Did I hear you correctly?
Yeah, so I recently completed Gottman level 1 and 2 for couples counseling. It was out of curiosity, right? Because Gottman has a very different approach um, to the way couples should discuss their differences. So I was curious about that, and it brought me to the Gottman training. Um, you talked about the intimidation factor when you go into a person's office, and now you see all the acronyms. I don't think there's a profession in this world that has as many acronyms as we do. CBT, DBT, EMDR. I've like it's ridiculous. So I am Gestalt trained, yet another big word, right? What that means is my focus is on the body of the person, right? So it's body centered psychotherapy. It brings some somatic pieces to it, meaning that there's a way in which our feelings and emotions manifest as body reactions. So I am drawn to those people who say, well, there's nothing medically wrong with me, but my stomach hurts all the time, or I get these unbearable migraines, or this is happening and I don't know why this is happening to me. So that's my approach, right? So the Godman training for couples, but that's not my only expertise in terms of couples counseling. Ultimately, again, it's about, building a relationship of trust so that I can understand how to better help this person.
Yeah, yeah, and that's really cool. So it sounds like there's a lot of tools in your toolbox, so to speak. Um, but it seems like for you, the relationship with the client is paramount. It's more important than even the specialty and the focus. Is that?
I will say to you that without a positive therapeutic alliance, without
Mhm.
some sort of form of bond and trust between client and therapist, that relationship cannot reach its full potential.
Mm,
That's my opinion. I don't know. Maybe I bring that Eastern European, uh, you know, group culture, to the mix. But I believe in being a fellow human, and that's all that you are to this person. I want them to see you as, because the thing is, I don't want to be the expert in the room. How could I possibly be the expert in your life? You're the expert in your life. I'm just here to maybe hold a mirror so that you can see your your patterns, right? And so I can
mhm.
better help you shape your life.
Yeah, yeah, that's awesome. I really appreciate that. Andrada, some clinicians are very solutions focused, or like pushing to the goal. Others are a lot more laid back. They let the client lead. How would you describe your style in session?
Ah, this is a tough one for me because it's a learning piece that I have to still build upon. I try very hard not to help, right? And it can be frustrating sometimes to not help, right? Um, because I understand now that presence is enough. Presence is a lot more valuable than me providing solutions, but it's still a piece that I'm holding as something I can improve upon. Okay, I'm not there yet, right? I want to immediately jump into action and direct the session and help this person, and then I have to remind myself that they are the master of their lives.
Yeah.
Okay.
Mhm. Yeah, that makes a lot of sense because, if we are just giving the client direction and we're giving them solutions and we're telling them, hey, you should do that. Hey, try this. Like they're not really learning anything, right? Like we're not really teaching them the skills of problem solving and responding to life situations. And so in many ways, a clinician who does that, in some ways, can, remove that agency and that responsibility. Although I will say that there is a time and place to do that. Sometimes we do need to be directive, and yeah, I think you're right that there is a balance that needs to be struck there for sure. That's really interesting. Andrada, I'd like to ask about progress. If a client partners with you, they get through the first session, they're a good fit, and they've been doing some work with you for some time, what does progress look like?
So, those of us who, go through the billing process through an insurance agency of some kind, right? We are bound by progress in terms of measurable outcomes, right? So we look at the PHQ-9, right, which measures depression, or the GAD 7, and there are a number of assessments that we can administer. And when we initially start working together, and then 90 days later, to see if there's been progress in terms of like measurable outcomes. Has this person, is displaying increased mood as per we've observed they have less ruminating thoughts, sleeping better, etc. So progress in that sense, where it needs to be viewed as when we're looking at tools for measurement of progress, that is progress. That is not the kind of progress that I'm ultimately a big fan of. I do it because I have to. To me, progress is sometimes progress is not going backwards, and I don't think we place enough emphasis on this, right? Like, if somebody comes to me and they're struggling, and they've been struggling for a number of years, and they've had, let's say substance abuse issues in the past, a decline would mean that they would go back. If they're still clean and sober 3 months into our treatment, to me, that also is progress. And I may have a lot of people who disagree with it. This might not be the most popular opinion you're ever going to hear in terms of progress. Sometimes progress is barely measurable. Are they still sticking around? Did they decide to wake up this morning and not contemplating suicide anymore? That is progress. And I know we think of progress as this big, is not always noticeable, right?
Yeah, absolutely. No, yeah, that makes a lot of sense. Is that progress can be very, very small, very marginal. It could be a very marginal gain, maybe a symptom reduction. Instead of, thinking about anxiety all day, maybe they thought about it for most of the day instead of all the, you know what I mean? And so it could be really, really small like that. So I really appreciate that there is nuance, as you're talking about that. With that being said, so let's say a client decides to work with you, everything looks good. They start making meaningful progress, and then they've done multiple sessions. How do you know when a client is ready to graduate or maybe complete therapy?
Well, as a trained psychoanalyst, psychotherapist, I believe that we're never truly done with therapy. But in the spirit of this conversation, and in what the insurance companies would like to see, which is solution-focused brief therapy, ideally 6 months, maximum 2 years, then yeah, sure. Progress is you are no longer confronted with the same issues you were, or you are now better equipped to handle them, right? You're more confident, and you have a better understanding of patterns of behavior, so that you don't make life harder for yourself moving forward. And if a person tells me they're ready, I absolutely trust that they're ready.
Yeah. Awesome. Yeah, that makes a lot of sense. Andrada, so let's say somebody is listening to this episode or watching this episode, and they like what you have to say. They appreciate your opinions on these questions and your thoughts, but they're reluctant to reach out, maybe because just it's new, they have never done therapy before. What would you want them to hear?
I would like them to hear that, for me, therapy is another form of self-care. There isn't much of an opportunity, especially in our society, where you can have 45 minutes or an hour all to yourself with just another person, right? Who is there to be supportive, to hear you, to listen to you openly without judgment, and to move at a pace that's comfortable to you.
Yeah, that's great. Really, really great message for the viewer. All right, I like to switch gears and ask a little bit about yourself. Is that okay, Andrada?
Sure.
So what got you into therapy in the first place?
I needed help. No. I'm kidding. Sorry, I have a terrible sense of humor.
That's good.
What
Thank
got
you.
me into therapy in the first place? Well, first of all, I grew up surrounded by a lot of people who needed therapy and didn't get it. And I was one of those parentified children that saw the adults in around struggling, and I didn't understand why they didn't get the help that they needed. So that was one. And secondly, I was a school teacher, right? I was teaching high school, and I noticed that my students could not be brought to this place of learning because they had unfinished pieces. And it became very obvious to me that without being ready and being in the proper state of mind to learning cannot occur. So I wanted to, I was working my way backwards, right? I was a teacher for 5 years, and then I realized I cannot teach somebody who is in, system overdrive, and they're bringing a lot of panic and fear and baggage from home, right? For them, school was a safe space where they just wanted to nap, and I could have been that teacher that got mad and woke them up or send them to the principal's office. But I wanted to understand, I wanted to know more about how I could help, how I could be a better teacher. And I realized that to be a better teacher, I needed to have the social emotional piece figured out first.
Yeah, that's awesome. And what do you enjoy most about your work?
I don't know. I mean, I think we're all gonna say the same thing. That moment of the eureka moment, when you see the epiphany happen, when your client's eyes light up and they're like, yes, you're right. I do this, or I'm gonna go for that job, or you know what I mean? That moment, the aha moment. But those moments are rare, right? And sometimes, they don't come for a while. Sometimes you plant a seed and it takes years for the person to react to what you planted, right? It requires a lot of patience, and I am not a very patient person. So that has been my greatest challenge, I'll be honest with you.
Yeah, well, thank you for sharing that, and I do appreciate that because it could be a challenge sometimes when you've seen a client for a while and you're working and working and working, and sometimes it seems like there's no progress, and we're just like on this like steady state, and then out of nowhere it's like bam, like eureka, like my life changed, like I just woke up and I feel fine, whatever that may be. So I totally resonate with that. I like to ask Andrada, what do you do outside of the therapy office?
I do a lot. I like to learn. I learn a lot. I attend a lot of trainings, seminars, workshops that I think will allow me to become a better therapist and a better professor. And I offer some pro bono work. I'm all about giving back to the community, the family. That's who I am. I just want. I'm all about the human experience, and I like to dance. I dance a whole lot. It's a very good form of letting out the accumulated trauma, or the the heaviness that we carry with us as psychotherapists, right?
Yeah, I took a couple of dance classes, and boy, I'll tell you, that's a workout. Like that, like sweating, you're just whoa. Yeah, that's good. That's awesome. Andrada, what's on the horizon for you in your practice? Are you maybe coming out with the online course, a coaching program? Are you just focusing on clients? What does that look like?
We're all looking for a niche, right? And there's that misunderstanding that you can be an ace of you can have a lot of what's that quote, master of none, whatever it is.
Oh, jack of all trades,
master of none, right? And I'm like, am I a jack of all trades, master of none? And it got me to research. The quote is jack of all trades, master of none, but still better than master of just one. So I love that quote in its entirety. Thank you so much for reminding me what the quote was, because it just went somewhere. And I love the fact that, because everybody is asking me, well, do you have a niche? Are you gonna niche? I don't have a niche. I feel like if I picked a niche, it would limit my ability to help as many people as I possibly want to help. I do have a passion because as a professor, I see some of the struggles that my student athletes are facing that are a lot different than the struggles of my non-student athletes, which has led me to wanting to gain a better understanding of athletes and performance and what makes a person choose that path, right? Because these are exceptional people, right? Less than 2% of the world's population becomes a professional athlete. So I want to understand more about what motivates someone to get there, and so I think that maybe if I'm going to ever pivot, it will be into sport performance and working with student athletes possibly. But like I said, I don't think I'll ever niche per se, because I still want to be able to help as many people as I possibly can.
Yeah, and I think there is something to be said about that, because if you understand, or if a clinician understands the principles of therapy, like the basics, the common factors, like just like the building a good relationship, you can really kind of help anybody, if you really master those principles, regardless of the niche. Now, granted, there are some niches where you need some specific training, I'm sure, but you could still be effective if you understand and have a good quality understanding of those principles. What are your thoughts on that?
I would say that I am human, and nothing that is human is foreign to me. And I think because I bring this experience of being human, I have that means to connect with someone. I will never know what it's like to live life as an alcoholic or an addict, and that is a very humbling place for me, for example, right? My goal is to never present myself as the expert, because I cannot be the expert on your life, and I can never fake walking in a mile in your shoes. That's huge to me. I mean, when clients ask me, like, how would you approach this, or what would you do about it? And I'll say, I can tell you what I would do, but it would be from my own perspective, based on my own lived experiences. So that piece of advice won't mean the same thing to you, right? If I am to say to you, that's what I would do, it's probably not applicable in your experience. Right. I believe in getting very good and perfecting something, but I want therapists to do it because they're passionate about it, not because it's a trend or a fad like EMDR. Everybody wants to be EMDR trained now. I think it's a great certification to have, but I don't want us to go in that direction because it's what's most sought after. The most marketable niche is what's upsetting me about our profession. Sometimes talk therapy is just as effective as something very, like a very specific niche. Again, it might not be the most popular opinion, but I believe that we're wired for connection, and everyone requires presence. We want to be seen, heard, understood. That's all we need. And it doesn't take a special certification for that.
Yeah. Wow. Yeah. That's sounds like that's a great topic for a whole different podcast episode. But so focusing on your clients going forward, that's kind of going to be your focus. Does that sound about right, Andrada?
Yeah. Going forward, like I said, maybe helping more student athletes. It's, like I said, it's becoming an interest of mine. But for the most part, just being the best therapist I can be, and the best human I can be. That's my goal for myself.
Yeah, that's really good. I appreciate that a lot. Andrada, this has been so good. I really appreciate your time and coming on the show. If people are listening to this and they want to reach out to you, partner with you so that they can maybe start their therapeutic journey with you, how can they reach out?
So I have this very unusual name, right? So it's quite possible that if you just type Andrada or Mihaila in psychology today, I'll be the first one popping up. Or you can look up Romanian speaking therapists in Western Massachusetts. I am currently located in the Springfield, Massachusetts area. And like I said, I'm available through Psychology Today. My business cell is listed on there.
Got it. Yeah. Thank you for that, Andrada. And I'll make sure to plug that stuff into the show notes. Yeah, really appreciate you coming on the show. Maybe we could do it again in the future. How does that sound?
I would love to, Rich, and I really appreciate you doing this. It means a lot.
Yeah. Yeah. Awesome. Well, thank you so much again. I appreciate it. And all right, everybody, signing out. And until the next one.